on devotion, so turn it up, lean in, let the real talk begin. Mr. Real's podcast, let's roll right in.
Hello, this is Ryan, Mr. Wheels podcast, and hello everybody. Welcome to the Mr. Wheels podcast, where we talk about honesty, about disability, healthcare, politics, accessibility, what it really takes to survive as a disabled person in America. Today, I want to discuss something that may confuse people who have never had build their lives around doctors, medical equipment, prescription, specialist insurance approvals. Why do so many disabled people prefer Medicare over private insurance? I want to be very clear from the beginning. Disabled people are not monolith. Medicare is not perfect, and private insurance experiences vary widely. But for many disabled people, Medicare can offer something that private insurance often fails to provide. First one, stability. When you depend on health care to function, stability is not a luxury, it's part of the foundation. This is my personal experience. I made a difficult decision to transition from full-time employment to part-time so I can qualify for Medicare through the disability benefit system and leave private insurance. That was not an easy decision. Working for fewer hours meant earning less money, and it meant changing the way I thought about employment, independence, and financial security. It meant confronting a system that often forces disabled people to choose between working as much as we can and maintaining access to the healthcare that makes working possible in the first place. That is the cruel little hamster wheel hiding inside America's healthcare system. You need healthcare so you can work, but working too much can threaten the benefits that provide you healthcare. And for me, private insurance did not offer the stability I needed. My coverage could change with a job. The premiums could change. The network could change. The deductible can change. A doctor who was covered 1 year may not be covered the next. Eventually, I came to a point where remaining on private insurance is no longer felt the safest and most sustainable option right now. Going part-time was not about avoiding work, it's about protecting my health, creating a path of coverage I could depend on. That is an important distinction between the two. Healthcare is different when you're disabled. And for many non-disabled people, healthcare is something you might use occasionally. They receive an annual checkup, fill a prescription here and there, or visit their urgent care when they get sick. For many disabled people, insurance is involvement in almost every corner of their life. We may need specialists, physical therapy, occupational therapy, mental health care, medication testing, home health services, hospital care, mobility equipment, wheelchair repairs, replacement of different cushions, accessible transportation, and other medical supplies. Medicare offers covers many forms of durable medical equipment, including wheelchairs and scooters when its medical necessary requirements are met. That does not mean getting equipment through Medicare is always easy. Anyone who has fought for a wheelchair knows the paperwork that can grow technicals, but having a national program with established coverage rules can provide a more predictable starting point when an employer plan that changes every year. When your healthcare needs are constant, even a small disruption can become a crisis for a lot of people. A delayed wheelchair repair is not simply an inconvenience, it can leave someone trapped at home. A rejected prescription is not just an annoying phone call, it can cause pain, withdrawal, hospitalization, or the worsening of a medical condition. A specialist being removed from an insurance network could destroy a treatment relationship that took years to build. Disabled people are not shopping for health insurance, although we are comparing streaming services. We are trying to protect our bodies and our independence. And right now, Medicare is not tied to one employer. That's one major difference. And a lot of the major reason is the people value Medicare. It is not tiered to a particular employer that you might work for. A employer sponsored private insurance can create what is often a called job lock. You may remain in the position that's harming your health because leaving the job could lose your doctors and prescription and treatments and medical equipment coverage. But this is exactly what I'm going through right now. I have insurance and I'm buying a wheelchair that is required for me to, be independent. And but the thing is, I started the wheelchair process back in April, and I was offered to do part time, but I can't go part time until the wheelchair is paid for. It could be another month. So I am tied to that right now, and it is hurting me. That's not freedom. That's healthcare being used as an echo chain. Medicare coverage obtained through disability generally begins after a person receives qualifying Social Security disability benefits for 24 months, with different rules that might apply to certain conditions as ALS. The waiting period can be brutal and should be reconsidered, but once coverage begins, it is not controlled by one employer's human resources department. Social Security has work incentives intended to let someone that receives SSDI beneficiaries and test their ability to work while maintaining the benefits for a period of time, which I just did, and I'm at the end of it right now. These rules are complicated and depend on earnings and timing and individual circumstance. The system still creates a benefit cliffs, confusing fear. My own move to part-time work demonstrates how deeply employment decisions can become entanglement with health coverage. No disabled person should have to deliberately reduce their income to obtain medical care. It's crazy. And we're moving on here. Original Medicare can offer a wider choice of providers. Another major difference is provider access. With original Medicare, a person can generally see any doctor or hospital in the United States that accepts Medicare. A private plan, including many employer plans and Medicare Advantage plans, may restrict the patients to a particular network. What difference matters when you have a complicated disability? You may not able to choose a random doctor from the directory and hope everything works out. You may need to see a neurologist, rehabilitation specialist, orthopedic surgeon, wheelchair seating clinic, and another provider with specific experience they require. A narrow network can turn healthcare into a scavenger hunt and accept a prize as appointment that's about 7 months from now. That's exactly what I'm going through right now because I have lymphedema as well, and I need to see a doctor, but I can't see him until after the first of the year. And that's one thing I don't like. But original Medicare can provide more freedom to seek care from participating providers across the country. That's especially valuable when your specialized disability care is not often available in your immediate community. And there's also fewer prior authorization barriers. If prior authorization is another reason some disabled people prefer original Medicare, prior authorization requires a health plan to approve certain services, medical medications, equipment before the patient receives them, which I'm going through right now through the private insurance. And many private insurers frequently use those requirements as a cost management tool. Medicare states that original Medicare generally does not require prior authorization for most covered services and supplies, and Medicare Advantage plans, which are operated by private insurance companies, which require prior approval for certain care. That distinction is very important. Medicare Advantage may carry the Medicare name, but is still administered by private insurance companies, and it can include useful benefits such as dental, vision, and hearing and prescription coverage, and a annual out-of-pocket limit as well. However, the plans may have networks, referrals, and prior authorization requirements. When disabled people would say that they prefer Medicare, many are specifically talking about original Medicare, not necessarily every private Medicare Advantage plan. A prior authorization can be frustrating for anyone, but disabled people often need more services and more frequently. That creates more opportunities for delays and denials. We should not have to repeatedly prove that a permanent disability is still permanent. And at the same time, the coverage is more standardized. And private insurance can feel like a trying to read a map while someone changes the rules as we go. Employers switch insurance carriers, plans change formularies, deductible rises, co-payments, increasements, and all of that kind of thing. And networks shrink as well. And coverage rules are buried in documents written in a dialect apparently developed by lawyers living inside that filing cabinet. Medicare is complicated as well. Parts A, B, C, and D, supplements, enrollment periods, and premiums, and deductibles, and assistance programs that can be overwhelming for a lot of people like myself. But the original Medicare operates under national rules. Part A covers hospital insurance, while Part B covers medical services as doctors' visits, outpatient care, and certain medical equipment as well. That does not eliminate the bureaucracy that goes through. It does create a more standardized framework than many employers sponsor plans. For so many people, coordinating with several specialists and ongoing treatments, predictability can make an enormous difference. Medicare is not perfect. I do not want to paint Medicare as a magical golden insert card at all. Original Medicare has serious gaps. It generally does not cover routine dental care, routine vision care, hearing aids, and much long term care as well. And also does not have an annual out of pocket expense unless its beneficiary has additional coverage, such as Medicaid or Medigap policy after the Part B deductible, and the beneficiaries commonly pay 20% of the Medicare approval amount covered by Part B services. That 20% can become very financial avalanche for a lot of people that need frequent care or very expensive equipment. People under 65 may also face difficulty purchasing affordable Medigap coverage, depending on the state law and personal circumstances as well. Medicare can still deny claims. It can still require documentation. Wheelchair users can still face long waits for equipment. As I stated previously, I started my process of getting a wheelchair back in April. Here we are, we're in July, almost in August. From my doctor, I think it's to be by mid-August when I get my brand new wheelchair. Disabled beneficiaries also report significant insurance and access problems, even when covered by Medicare as well. So this is not a story about Medicare being the perfect by all means. It is a story about Medicare often being more dependable than the alternatives available to us. And the actual real problem is a choice that we are forced to make. My decision to transition to part-time employment should not have to been necessary for me to do it. I should not have to weigh my working hours against access and medical coverage. No one should have to ask, can I afford to earn more? while accepting this promotion cost my healthcare and my health insurance. While working full time make it impossible to pay for the care I need. Continue to working. And these following questions reveal a system designed around employment, status, and insurance company rules rather than human needs. Disabled people want to work when our bodies and circumstance allows. We want to contribute, create, and lead businesses, build careers, and participate in our communities as we continue to live. But work cannot be treated as a proof that a person is no longer a disability or longer needs health care. A paycheck does not make cerebral palsy disappear. A promotion does not repair a wheelchair. A full time schedule does not erase medical expenses. In closing, for me, leaving private insurance and moving to Medicare was about choosing this stability. It was about knowing that my coverage will not disappear simply because an employer changed insurance companies. It's about creating a better chance of keeping access to doctors, specialists, and treatments and equipment. It's also a sacrifice as well. I transitioned into part-time work because there was a system placed in front of me that made a decision that protected my health, but disability people should never have to be forced into poverty, reduce employment, or financial insecurity simply to qualify medical care. Medicare needs improvements. Private insurance needs accountability, and America needs a health system that does not punish people for being disabled by working, earning money, or trying to build independence in lives. Healthcare should support employment. It should support independence. It should support life in the community. It should never become a trapdoor for people to fall through. This is Mr. Wills reminding everyone that healthcare is not a reward for having the right job, the right income, or the right body. It is a human need. Thank you for listening right now. Please share this episode and subscribe to Mr. Will's podcast. And continue to speaking up for a healthcare system that puts the patients before the profits. In closing, thank you.